Worksite Wellness. Now, if you are interested in starting a Worksite Wellness program, in the chat, put me. Okay, me. You might be here to get inspired about a program that you've been working on, or you know, especially now, it's something we need to do for our work culture. We need a work culture that promotes health and wellness. Let me know in the chat, and definitely make sure we follow up with you after this is over. We're springing forward for 2021. I'm going to talk about some health surveys and different assessments you can use to help you get an idea of what your population may need and what they may benefit from. Also, MESSA, we have lots of planning resources to help you and information to help you create some great activities. First, let's talk about survey resources. Excuse me. So you can use a health risk assessment. You can use a health interest survey, and as MESSA members, what we also have is a wellness report card, and let me tell you about that. With the health risk assessment, we work with a vendor called MetaKeeper, and as a MESSA member, you can personally log into your My MESSA portal. So you log into the portal, and you can log into the health risk assessment. Now, what the health risk assessment does for you personally is you complete at least 20 minutes worth of questions. So it takes about 15, 20 minutes, answer the questions, and you get immediate feedback on what you need to do to start your wellness journey. The information is private. Not even me as an administrator, I cannot get your information. I can only know you took the health risk assessment, okay? So you start on your personal journey towards health and wellness. Now, you as a program planner, if you have a Worksite Wellness committee or a team, or you are the wellness liaison for your district, your association, your group, I can provide you a de-identified report. So it doesn't have anyone's names on it. It's an aggregate report that can tell you where the burden of risk is in your group. So that means after your group completes the questionnaires, it's a report that can tell you that this percentage of people are sedentary, or this percentage of people are not eating enough fruits and vegetables, or this percentage of people are not getting their annual physical. So as a program planner, that can help you target in or focus in on those areas that are most important. We know that your time is limited, so you want to focus the most energy where you need it. So it helps you to customize the program. And again, if you're interested in that as a program planner, so what this would look like in a Worksite Wellness program, say at the beginning of the school year, you want to make sure, or you want to encourage or motivate your colleagues or your work group to get their annual physical, because we know during this last 12 months, getting health screenings or getting your physical has not always been the priority, but now it is. So this is a way to motivate your group into going to get their physical. Start with your health risk assessment. Start your wellness journey here. Looks like a lot of things are coming up on the screen. Can you guys see okay? Next, the health interest survey. Now, we have a unique health interest survey that we use with our districts. Okay, so if you're interested in that, let me know. And you can also find this in our wellness toolkit on our website. But a health interest survey is a way to find out what your group wants. You know, so often we plan activities, but we don't find out what people really want to do. We don't find out what time they're available. We perhaps don't take the time to find out the ideal communication mode. You know, you might have one part of your group that prefers email, the other part, they don't look at the email and they just want to see it on the board in the break room. So you find out where or how your group communicates. You find out the things they want to do. You also can find out if you have some talents or skills within your population. You may have people in your group that would love to offer a yoga class, or or a Zumba class, or you may have people in your group that would love to facilitate a mindfulness session. You may have all the talent you need in your group. So a health interest survey is a way for you as a program planner to collect that data. Very simple. And again, it saves you time in planning because you're planning specifically what the people want. And that would ensure that you get participation, because that's the number one thing we're looking for. We want to provide people something they'll do that will help them. Last but not least, our wellness report card is unique to MESSA members. So if you have a worksite wellness program with people that are do not have the MESSA insurance, their information wouldn't be on this report. Those people not accepting insurance, but for those that are utilizing their MESSA, this is a great way to get a snapshot of their healthcare utilization. So in other words, are we getting our preventive care screenings? Are we getting our colonoscopy? Are we getting our mammogram when we're supposed to? It'll give you an idea as a program planner. Is our group utilizing their MESSA to its fullest? Are we optimizing it? And again, it can help guide your campaign creation. It can help guide how you program and how you decide to disseminate information to your group. You might find that your group perhaps is not getting their mammograms like they should, the women in your group. So you might design a campaign the same month as Breast Cancer Awareness Month and just disseminate information on the risk factors of breast cancer and perhaps the things people can do to lower their risk, the protective factors like engaging in healthcare screenings. Planning resources. First, on our website, I want you to know we have a Worksite Wellness Toolkit. We created that for you to help guide you through. Now, of course, I'm here as a health promotion consultant to help you. And I love jumping on a Zoom call with the team and letting them know some different best practices in worksite wellness they can do. But we have this toolkit. You can go out right now and download it at mesa.org. And it has information on different campaigns. It has every flyer that we give out that pertains to one of MESSA's wellness benefits, like our medical case management or our program called OMADA. It has it there for you. So you can download that for your records. Download it today when you get off this conference and have it ready for your first Worksite Wellness Committee meeting. So you can open this toolkit right up. And it'll tell you the 3 keys of wellness that we promote for worksite wellness and personal wellness, and that's mindfulness, movement, and nutrition. Also in that toolkit and on our website, we have an activity calendar. And our intention is we want to make things as easy as possible. So we've created everything you need. So again, when you schedule that meeting or you get with your partner about planning your wellness school year, your curriculum, we've created a calendar to kind of inspire some ideas, okay? So you bring the calendar with you to the first meeting, you bring the results of the health interest survey, you bring the results of the health risk assessment or the wellness report card, and then you bring your own subjective experience of living and working in this district, in this work culture, and you put all these things together and you start planning things for your school year. Now, this is a free tip. I'm gonna give you this because I like you a lot, okay? There is a health observance for every month. It's global and it's national. So if you get in your search engine and Google CDC National Health Observance, okay, what'll come up is a calendar for the year and every theme, every health theme that is observed for each month. So February is heart disease. All over the nation, everyone is doing something to raise awareness of heart disease. You've heard of Wear Red Friday. That's that first Friday in February. Same thing with March. If you Google it, March is Nutrition Month. So you, as the expert program planner you can use that as your guide, your curriculum guide for the year. March, we're going to do nutrition because our health interest survey said people want healthy recipes. They want more information on meal prepping. They want to understand nutrition better. So we're going to do it in March. So let those months guide you in your program planning. We're trying to make it as easy as possible for you to create campaigns. Also within that toolkit, you can create campaigns based off of just general healthcare. You know, I always tell people, everybody doesn't want to do a marathon or a walking challenge or compete in a bodybuilding contest. And that's fine. We don't want to mandate anything. We want to motivate and inspire. But you know what? Everyone needs to get a physical. Everyone needs their health screenings. Everyone needs to do things that help promote health and help prevent disease. So this is a great way. These health maintenance campaigns are a great way to just get every normal people, everyday people into being concerned about their health by creating a campaign. And you can find that in the toolkit. And I'm rushing along. Again, structure, the easiest way to structure your personal health journey and your group worksite wellness program, or your community or your family. I like to look at it as what can work instead of what is wrong. Often, because I tell you, I'm providing you these survey tools, but let's say we just throw away all the survey tools. We don't have time to survey anyone. I guarantee you, listen, I put money on it today that your group needs to move more. I put money on it today that your group needs to eat better. And you know what? I might even put my house up and risk it that your group needs to manage stress. I'm pretty certain. So if you didn't do any type of survey or evaluation, I guarantee you that mindfulness would be a benefit to your group. Movement, you know, the principles of movement would be a benefit to your group, and the principles of nutrition. So here are some things you can do within each one of those keys. Mindfulness. So this will work virtually, and this will work brick and mortar. I've tried them both. I did it. COVID pushed me out into the virtual world, and I had to learn and make sure it works, and it works. So different things you can do as far as mindfulness. Mindful Monday email messages. So basically, use your email. You don't have to go anywhere and send out messages to remind people to practice meditation, or even if it's just an image to help relax people and to help them focus. Okay, you can do this simply. If you just did this, let's say you're here by yourself and you are thinking, man, my administrator sent me here and they want me to come back with some ideas for a worksite wellness program. Mental wellness, mental health is a big issue with my colleagues. I have to have something. I have to leave. Well, here you are, dear. Here it is. Do a Mindful Monday email. That's all you have to do, because health promotion and worksite wellness is just about disseminating information, right? You disseminate information. Maybe 3 people will move or change behavior, and the other 100 people won't change behavior, but a seed is planted. You're putting it in front of them. And what we know about health promotion theory is if people keep seeing that message all the time, they see a billboard, they see a poster, they see your email, eventually their brain will connect and they'll start engaging in that behavior. So Mindful Monday email. Now remember, gratitude, I talked about that before we even got on this worksite wellness subject. There is so much science about gratitude and appreciation. It changes your brain, just like complaining does. They both work. Complaining will work. Now, I know I'm dealing with the public school industry in this house today. And some of you are so passionate, I don't know what I would do without you. I'm glad you complain. I'm not going to lie to you. I need you to complain at bargaining table sometime. Managers, close your ears. I need you complainers, but this is it. I need you to balance this thing out, okay? I need you to incorporate some gratitude in there and be intentional about it. And your colleagues need you to do it as well. To incorporate some gratitude, because think about it like this. It's not just that you're being nice to people. You are increasing your health and wellness. Because what happens is when you start engaging in gratitude and appreciation, this is what science tells us. It lowers your cortisol, it lowers your stress hormone, and it allows those good chemicals an opportunity to optimize and help you feel better. So what happens when we're able to manage our cortisol? We create a stronger immune system, right? Everybody's talking about immune system. I'm sure if we wrote Google a letter, the #1 word that's being Googled in the search engine is immune system health, right? Everybody, well, this is easy, this is free, I'm giving it to you free. You know, you can pay me, but it's free. I'm telling you it's free, right? Start practicing gratitude. Wake up every morning and engage in some gratitude practice. I'm seeing something on my screen. I hope you guys don't see it. Okay, good. Gratitude. And this is something you can do not only personally, you can do it with your family, teach it to your kids, but you can create a campaign with your colleagues. It could be at the beginning of a meeting where everybody just talks about or mentions something they're grateful for. It's your turn, Joan, for this meeting to mention something you're grateful for, somebody or a situation, okay? 30-day resiliency is another thing you can do, and virtual mindfulness practices. I'm engaged in a couple virtual mindfulness practices. You may have a coach on your district. You may have somebody that has been taking mindfulness classes that would love to assemble some people virtually or in the break room for 30 minutes once a week or maybe daily for mindfulness. Science supports the benefits of mindfulness, the mental wellness benefits, the physical wellness benefits. It's a plethora of benefits when you are practicing mindfulness. So I hope that's helping. I can't see the chat, but you put your questions in. Somebody is watching for me. Movement, okay? When we're talking about movement, like I said, it's not necessarily a marathon, but we need to stay active, especially during these times of physical distancing, right? We have to be intentional about it. I realized during this last 12 months, I haven't been as active as I usually am. My gym is closed, working from home, and I calculated this, and I may have told you guys this the last conference, but just not getting up, driving to work, walking in the parking lot, up 4 flights of stairs, and moving around throughout the day in and out of offices and on the stairs, I calculated that to be about 300 to 400 calories a day. So that times 5 days a week, what is that? 1,500, 2,000 calories. You multiply that by 52 weeks. We have some issues here, Rhonda. We have some issues that you have to address. So I say that to say we all need to really be intentional about movement. It really counts. And it's not just the jog and the gym time. It's that everyday activities of daily living movement. So some things you can do: step challenges, walking challenges. We're planning a plank challenge, okay? And we're gonna do it virtually. So what we did is we sent out a registration to see if anyone was interested in doing a virtual plank challenge. We got at least 100 people that said yes. We'll see when it comes time to do it. But what we plan to do is get on a virtual call, set up the cameras, get some referees available, and do a plank challenge just for the fun of it. Break away, help your colleagues break away from the desk, break away from the projects and the stress, and just have fun virtually doing a plank challenge or a squat challenge. We also, with our Worksite Wellness, we created a fitness directory, okay? So, and we use just the recommendations of our colleagues. So people gave us recommendations about personal trainers, about YouTube videos, about DVDs out there, celebrity fitness personalities, and we created a directory that is available to everyone who works for this organization. You can do that for your school district and for your location where people will have no excuses. Here is a recommendation from somebody you work with. And as far as nutrition goes, a 21-day mindfulness challenge. Now you can do this again, brick and mortar, or you can do it virtually. Teaching people how to engage in mindful eating. And it's not just about doing it as a competition, but you're teaching people the benefits of mindful eating. There is the digestive health benefits, there are mental wellness benefits, and basically, to sum it up, when you slow down and really eat the way you're supposed to, chew and allow your body to digest, your body's able to really pull the nutrients out of the food. And that's what we need. We need to restore the nutrients in our body that we are using up, or our body is using up, because of chronic stress. And here's some other different ideas for nutrition challenges. Other things, has anybody tried the online lunch gathering where you log on, you send out an invite, meet me for lunch, or meet me for happy hour, and everybody just logs on with their choice of beverage or lunch, and it's a way to minimize this feeling that we're not with people. And what it does is increases community and increases camaraderie, and it really does benefit our mental wellness. There's something about being human and having a social network, having a social outlet. They work together, and we really need it. And we know for sure after this situation with the pandemic that that is something that we need. Desk cleanup challenge, I love that. And even offering on-demand fitness challenges or on-demand fitness classes. Like I said, you may have somebody in your group that can provide those, and you can do it again, brick and mortar, and you can do it online. So MESSA Resources, real quick, I want you to be aware. Again, I am the health promotion consultant, and I can come out and work with you at your school building or virtually. I can help guide your Worksite Wellness committee. I can help you personally. We have so many resources. We have posters. We have challenges that we've created and that we've tested that work well with groups. And I'd love to come and sit and help guide you towards the best practices in the wellness industry. Wonderful field reps, they're in the house. I've seen them around. They definitely can help guide you with your MESSA benefit. They could be your first contact if you have questions about your benefits. And believe me, they rise to the occasion when you have a need. If you have questions, definitely our field reps are there to help you. Even if you want to start something wellness, they would be your first contact to contacting me. Our case management program, I don't want to miss our member services. We have an award-winning member service department, and we've added a chat feature the last 12 months. So even if you don't want to call, I mean, if you want to talk to somebody personally, somebody will answer right away. Or we know this is a generation that loves doing things virtually. There's a chat feature available as well that you can use. Any benefit questions you have. Some of our resources. Now with Worksite Wellness, this is a great opportunity for you to share MESSA resources with your colleagues, with your school district, those that have MESSA, because often they don't know about these different features unless they need them, right? So our case management program, we have nurses that are highly qualified, educated, and trained in these specific disease processes. So we have a certified asthma nurse, a certified diabetes educator. We have a nurse certified in cardiovascular health that can help guide you or your family member through those chronic conditions. And what these programs involve is coaching. So initially they'll do an assessment, and then they will help you create a plan, and they'll stay with you and coach you through it until you reach maximum medical improvement. So that may be if you have a heart attack or one of your dependents has a heart attack, they're in the emergency room nowadays, they stay in the hospital probably one day. After that, they meet with the cardiologist and they're given medication and a diet. Well, we're here to help them understand it. The nurses can help walk them through that new medication, can help walk them through that new eating plan, and stay with them a length of time that is adequate until they're able to do it alone and by themselves, self-sufficient. Also, our medical case management, wonderful program. That's actually the first program I started with when I came to MESSA 15, 20 years ago. And this is for our members that are facing catastrophic situations, catastrophic illnesses, requiring them to be in the healthcare system for a long time with multiple providers, multiple specialties, perhaps high-cost medications, high-cost durable medical equipment. And these case managers help guide them not only through their local healthcare system, but we have case managers here at headquarters that guide them through the benefits. So they work together with the case manager in the field to make sure that you or your loved one, your needs are met and you meet medical maximum improvement. So the Worksite Wellness Program is a great way to spread the news about these programs. Again, our Blue Cross online visits are still available. There's mental illness treatment with those. Again, from the convenience of your home or office, it's still available free through December 31st, 2021. If you have questions about that, reach out to your local field rep and they can help guide you through that, your specific benefit plan. Livongo and Omada. Okay, so Omada is for our members that are at risk for diabetes. Remember when I mentioned MESSA is very serious about helping our members either prevent chronic disease or delay the onset. And our members that are already challenged with chronic disease, we want to help you manage it so you can live your optimal level of well-being. So these two programs help with that. Omada is for you if you are at risk for diabetes. And I tell you, if you're over 40, you're at risk for diabetes. But what happens is you take an assessment and it tells you if you're at risk. And it is a free program. And what they do is they provide you a coach. And what that coach does is help you understand stress management. Remember, I talked about mindfulness, movement and physical activity, and nutrition. Those are the 3 keys, okay? 3 keys to preventing chronic disease. Livongo is for our members that have diabetes already. And this is a great program again. Your first choice, you want our diabetes educator, Rachel with MESSA. Now, if you have Livongo can help in other ways, and it's also digital, okay? And if you have more questions about that, seek out your field rep in your location. Ovia. Now, these things are wellness. We believe wellness is health promotion, health prevention, and chronic disease management. So, and even when it comes to starting a family. So Ovia is a program for you if you are planning, if you're having difficulty, or you're just thinking about planning a family. This is a great digital resource, again, with a library of information that can help you. Now, last but not least, some of our online tools. You can go to them right on the break if you want to, or after the conference is over. MESSA.org, everything you need. You can log on to your personal portal and check your claim status or your EOBs on our My MESSA portal. You also can log in to the health risk assessment. You might want to do that after this conference is over. And our new platform, My Stress Tools, that is where you log on to My Stress Tools is through the My MESSA portal. Check us out on Facebook, okay? Join us, become a member, follow us on Facebook. We provide a lot of good information on health and wellness and even our benefits. Follow us on Twitter if you're out there in social media like that, Instagram and YouTube. This conference, as well as past conferences, you'll find on YouTube, okay? So we don't want you to miss a thing. My Stress Tools is launching, okay? And we're live out on the platform today. And what I want you to do, everyone listen. Are you listening to me? Okay, check this out. My Stress Tools. I want you today, sometime today, to go and log on to My Stress Tools. So it'll create you a profile. It'll recognize you. And I want you to go to the Stress Profiler, okay? Stress Profile. Complete your stress profile for me. And what we're gonna do is email me a copy of your certificate you get as completion, or some type of verification that you completed your profile, and we're going to enter you to win a wonderful prize. I want everybody to know where they land in their stress profile, and that'll give you an opportunity to explore that platform, okay? Do that for me sometime this week, and I'm so glad you were here today. Listen, we're going to take a break. Okay, next up, we'll have James Porter. He's going to talk about how you can maximize mindfulness. And actually, he is the founder, the creator of My Stress Tools. Okay, and he's in the house. I saw his face in the house. So take a quick break. What do we have time for, folks in here? It's 9:46. What time should they be back? 10 o'clock. Come back, log on 10 o'clock, go stretch. Go grab something to eat, get you some water, get up, don't just sit there, and I'll see you at 10 o'clock.